we recently hit 5,000 subscribers. I literally remember when I had less than 100 subscribers and I was probably in this very room at George Green, which is at the University of Nottingham. So it's insane to think about the journey we've been through. But I was scratching my head for a long time thinking, okay, what do I do to celebrate 5,000 subscribers? And I remember thinking, okay, I could do like 5,000 Unky cards. Yeah, that just wasn't gonna happen. But anyway, I thought what would be much more enjoyable for both me and you is if I reacted to scenes that involved medical students in some of the most popular medical TV shows. Grey's Anatomy, House, ER, Scrubs. So yeah, I'm really excited to react to these.
Oh no, would you look at this?
That's the first tailored white coat I've ever seen.
Where's the hero?
Think he knows anything?
He knows how to dress.
Well, it's my student.
Okay, that opening bit is such a mood. It really is the most nerve-wracking thing, starting a new placement when you don't know anything, obviously because you've just started that placement. And when you have all those doctors looking at you, it honestly feels like you even forget how to walk. Like, it really feels like you don't know anything and you just start doing the most embarrassing things. Like, everything becomes so awkward. For example, you'll be following a doctor and like you'll follow him into the toilet by accident. So yeah, I'm with the medical student. He probably looks a bit stupid because he feels so nervous.
This is the admitting desk. If you need someone paged or a chart called up, you do it here. This is Timmy. Don't shake his hand, he's afraid of disease. This is the way to the lab. We do crits, counts, spin downs. Chemistries are marked with these slips and left at the front desk. Mark everything stat, whether you want it fast or not.
Luckily, as a fourth year medical student, we don't actually have to request things like bloods or, I don't know, call different departments. Maybe in GP, but it's much less fast paced than it would be where I'm guessing, which is A&E. So I think it is unrealistic that all this information would be given to a third year medical student expecting him to be paging people, be paged. Secondly, that to me looks like a radiology suite. So radiologists who look at your x-rays and CT scans, etc., ultrasound as well, they're always in the darkest rooms. Like, I honestly feel like I'd go to sleep if I worked in a radiology office.
22, the heme lab is 6944. Memorize it. Everybody gets an IV the minute they walk through the door. Use an angiocath with a 16 needle. You need a large bore in case they're bleeding and you need to transfuse them. Do you know how to start an IV?
Actually, no.
I thought you were third year.
I am, but all I've done is dermatology and psychiatry.
The well-dressed specialties, huh?
Okay, that is the most accurate thing in the what, like, I feel like they just played out exactly what happened to me in my surgery placement. So once I got to surgery, I'd only done psychiatry, dermatology, ophthalmology and ENT. And so I was well into placement and I'd never taken bloods, I'd never inserted a cannula. I wasn't even really sure what a cannula was. So we got to surgery and the doctors were like, "Are you joking? How do you not know how to do this?" And they were kind of angry that they were going to have to be the ones to show us for the first time. So that is literally how it is. They'll be talking to you about things like you should be familiar with them, and then you'll have to be like, "I'm sorry, I don't understand the most basic thing that you said amongst that list." I love that. Is so true.
Well, you find that surgeons actually try to help people, not just build them. Now, the best way to do this is to pull the skin tight so the veins don't roll and go in low. Once you're in, pull.
Very good tip. So especially elderly people, but anyone, they'll have quite wrinkled skin. And if you try, and this has happened to me, if you try and put a needle, you'll basically just pierce the skin and you'll never get through to the vein. So you want to really press their skin down with one finger, then insert the needle with the other. And you do actually, a lot of people I think when they start, including me, think you go like that, but you actually want to go at like a 30-degree angle like that, so very shallow.
Now, what you want to do is you want to tape it, moderate flow, 2 or 3 drips per second. That's it. That's all there is to it. Okay?
Okay.
That's so accurate. You'll go over something like that and then they'll be like, "Do you understand?" And you'll be like, "Okay," because you're not going to be like, "No, sorry, could you go through that again?" But yeah, you'll likely need to ask a few more times. Plus, if that was how someone explained to me how to do a cannula and I was just told to go and do one, no. I had to have... You know what? To this day, I've never put in a cannula, but I've had so many teaching sessions and OSCEs on it that I feel like I could do one pretty easily.
All along here, you have the medical examining rooms. This is where the pill pushers kill their victims. But this is the surgical room. This is where the real action is.
Yeah, that is such a surgeon thing to say. They think that surgery is like the only real medical specialty you need. Well, they don't even see it as a medical specialty. They see like medical specialties and then surgery. Like, surgeons aren't called doctor, that you refer them as Mr., which has some sort of like antique background and history as to why. But they actually get offended, well, some of them, when you say doctor instead of Mr. That just goes to show how like much of a different league surgeons sometimes can think they are.
Your room will be down here. That's where you'll sew people up. Do you know how to suture? No. Okay, I'll teach you. Do we have anyone to sew up?
How would I know?
You know, I love this great spirit of camaraderie. Everyone wants to help, you know. Okay, here's...
I think as medical students, you're definitely treated like a spare part, so no one really has time for you. Everyone's like, oh, go and ask this person if you can do something, or go and ask that person. And then you go to that person and they told you to go to someone else, and eventually you've gone around everywhere and no one seems to have anything for you to do.
Good morning, ma'am. I'm Dr. Benton. This is Dr. Carter.
Good morning.
Okay, let's have a look. Can you feel this?
Yes.
Can you move your finger?
Of course, it's just a cut.
Dr. Benton, we have a policeman coming in with a gunshot wound to the lower extremity.
Put him in room 2, notify X-ray. I'll be right there. Now, here's all your stuff. Ask the patient if she's allergic to the locals or any drugs. And this is lidocaine. We'll call it Novocaine. They've heard of that. Ma'am, are you allergic to Novocaine?
My teeth are okay.
No reaction.
Okay, so that little blue kit he's carrying around is literally exactly what it looks like in hospitals. So what you do is that you open it up, and inside you'll find like a paper envelope with surgical sterile gloves inside, and you have to put them on in a very specific way, because if you touch the gloves with your hands, even though they're washed, you'll get bacteria. It means that when you go on to do like a procedure on a patient, you're going to get that bacteria into, in this case, the cut, which is really bad because it can get infected. So it's like a paper wallet like that, and then you have to be really careful. You can only like touch the bits that have been exposed to the outside already, so you open it like that, and you can only touch the inside of the glove, so you have to put it on like that. And there's such a specific way to do it, and like the surgical fellows or the surgeons will be looking at you very closely, like especially the scrub nurses, like, are they breaking the sterile field, or like, are they breaking sterility? And you'll be made to do it however many times until you get it right. But it is the, like, you think it's not hard until you're sweaty, you're clammy, you're nervous, and then the littlest bit of your pinky touches the glove, and that's it, you have to start again. So yeah, but that is exactly how they look like in hospital.
Reactions, rashes, anything?
No, of course not.
Now you inject both sides of the wound, expelling as you go. And you have to put on surgical gloves by yourself. You know how to do that, don't you?
This is so accurate. Like, as I said already, they'll keep asking you, so you know how to do this, obviously. You'll be like, no. And every time you say no, you know they think less and less of you.
Great. Here we go.
Bless him. Oh.
Now invert the wound edges and space them, because the tissues will be swelling over the next 48 hours. Space them the way that you see here.
Dr. Benton, the policeman's here.
Okay, I'm coming. Here, you finish.
And that's exactly what surgical gloves look like. No, poor guy. Okay, I'm not gonna lie, in this situation, I would say to the doctor, I do not feel equipped to be able to suture this patient, because I don't know how to do it and I don't feel safe. Because it is very important that no matter how nervous you feel, no matter how much you feel like you need to prove yourself, that you don't put a patient in harm's way. But I'd feel so nervous. To be fair, even if you've practiced something countless times in simulation, when you do it on a real patient, it's so different, because one, your anxiety levels are way higher because there's proper consequences, even if it's like a mild procedure. But also there's time pressure, and so many other factors that make it so much more nerve-wracking.
You still here? What do you think you're doing, assisting Chapel? Finish her up, start an IV in room 2. Bye, ma'am.
Nurse, could you bandage this for me, please?
Thank you, Doctor.
You're very welcome.
When do I come to have my stitches out?
Oh, 3 weeks.
When my son had stitches in his foot, they said 10 days.
Really? Well, 10 days, 3 weeks, anytime in there. Okay.
Okay, now we're on to the next scene.
Presents with abrasions and apparent trauma injury to her wrist.
Dr. House?
Continue.
Yeah. Yeah. A lot. Literally every time I presented a case to a doctor, they've been doing something else, which I present to them. Fair enough, because early on, your case presentation, so that's when you've just seen a patient and you summarise everything that's wrong with them, are very long-winded, not that great. So case presentations are a chance for you to grab the doctor's attention. So if they're on the computer writing notes, doing anything else, then your case presentation is your chance to get them to look up from what they're doing and listen to you.
She fell off her horse while riding in the county fair.
No, she didn't. She fell off the steps of her beach house. You must have gone to the wrong room.
Patients lie, but usually only one lie at a time. How much does she weigh?
It's her wrist, not her wrist.
Poundage, ladies. And by the by, what color is her nose?
She's thin.
Flesh tone?
What does this have to do with her wrist?
Almost nothing. She's either under 90 pounds or she has a red nose. I gotta go.
What's wrong with her?
It starts with C.
Okay, so a medical term that can be used for some cases of lying is confabulation. This is usually linked to some sort of neurological disorder. In the cases that I've learned about confabulation, it's in cases of excessive alcohol intake, but chronic, so for many, many years. They develop a thiamine or B1 deficiency, so you develop encephalopathy, and if alcohol intake continues, this encephalopathy can become irreversible, known as Korsakoff's encephalopathy. And with Korsakoff's, you start confabulating because your brain loses its capacity to remember things, and the brain, in order to fill in those gaps in the memory, the patient will lie, unconsciously lie to fill in those gaps. Although the fact that she's 17 makes it pretty much impossible for it to be due to excessive alcohol intake. She simply wouldn't have been alive that long to be able to have that level of intake to cause Korsakoff's, but there may be another reason.
Hi, Jody. I'm Dr. House. What brings you to the hospital?
My wrist.
How did that happen?
I was riding the Ferris wheel and this huge seagull flew right at me.
How horrifying.
I swung my arm at the bird, hit the Ferris wheel.
She's making it all up?
Okay, but we wouldn't say that in front of the patient.
I'm not lying.
Of course you are. You have no idea what happened. You have no memory. Korsakoff's syndrome. Her brain is damaged by excessive drinking or insufficient diet. Pretty obviously the latter.
Okay, so I'm quite proud there. Okay, let's go. I think the only reason I got that is because it's kind of related to psychiatry. But I didn't realise that Korsakoff could also be due to, well, I guess it makes sense, because you can have thiamine deficiency not just because of excessive alcohol intake, but also just simply due to decreased dietary intake. I hadn't considered that as one of the causes of Korsakoff's. That's quite interesting.
Can't even process that idea. So her brain fills the gaps as best it can using visual clues. The horse on your shirt led her to the riding accident.
Didn't realise it was
and the
visual
surf scene on your
either.
clipboard led her to the beach.
Korsakoff doesn't start with a C.
I didn't say C. Or did I? Lesson to be learned. Treat everybody as if they have Korsakoff's. We all lie anyway.
The group of fourth-year med students she's been courting to be potential interns, they're here for a 6-week rotation. She didn't talk to you about this.
No, she may have mentioned it, but I got pretty good at ignoring her.
Well, they're here, and they're yours. And they're all in the top 10% of their programs.
So they're completely socially inept.
Probably.
Okay, this might sound a bit rude, but I do agree a little. I feel like there's a bell-shaped curve for how good grades you get and perhaps how little of a life outside medicine you have. I try to be bang in the middle of the curve, which I think is a place to be. I don't need 100% to become a doctor, but at the same time, obviously I do want to do well. I think that's how you should strive to be, but obviously everyone has different priorities.
All right, here is the ER.
We are entering entering the ER.
All right, as you probably know, we are a level 1 trauma center.
We are a level 1 trauma center.
Dr. Weber, what is the trauma volume for Graceland?
Okay, the ER sees 120,000 cases a year, of which 5,000 are related to trauma, 22% penetrating trauma.
Penetrating trauma.
Your name again?
Candace Warner.
Candace, it might be a good idea to put away the phone.
I find the voice to notes app the most efficient way to record the tour.
And I find it the most annoying way for you to do the tour.
All right, coming through.
Oh, okay, what do you got?
Pedestrian versus SUV. Multiple open fractures. Arrested en route.
Let's get set up for an EV4 economy.
You mind if we observe?
As long as you stay out of my way. Chest tray, size 6.5 gloves. Ready? On my count, 1, 2, 3. Glove me. Vagina's chest. Someone take over bagging.
If you were busy dictating all of this into your mobile device, you'd miss all of them.
Oh no, I think that might be a bit dramatic, but several scrub nurses always check with me before surgery. Have you had breakfast? Have you had breakfast? And I always say yes, because there's always apparently a medical student that's fainted during surgery.
Dr. Weber.
Okay, look, everybody out. Let's go. Everybody out. Everybody out.
Get him up. This is the skills lab. Dr. Wilson, have you met our new sub-interns?
I didn't know that was a thing.
This is Dr. Wilson. She's a senior resident. You want to show the kids what you're working on, Wilson?
Yes. Well, this is a virtual dissection table. So for this case, I'm going to lift the omentum and then run the valve from the ligament of Treitz to the ileocecal valve.
Look up from your notes, people.
Sir, if I may...
No, you may not.
Tried that. There are no pending donors that match. This is where you come in. We want you to scour ERs, chase ambulances.
Isn't that a little predatory?
Well, the woman whose life I'm trying to save is a military surgeon. She's saved hundreds of soldiers' lives. She's a hero. So I'm okay with you feeling a little predatory. And whoever does find this donor for me gets to scrub in on the surgery.
I have been involved in some surgeries, but I usually stick to like holding the tissue, maybe cutting the sutures is as far as I'd go, but I just would feel too nervous and I don't think it's worth it. But wow, can't believe they're making them search for a donor in order to scrub in.
It's a good thing. Well, you want this.
What'd you call that? It's tea-colored, right? The guy we thought was just after the drugs. What's the differential diagnosis for urine that's tea-colored?
I'd rule out hematuria, which is blood in urine, because hematuria, if you've seen like pure true hematuria, is like red, if not like a deep like burgundy colour. You could have like an artifact, so as in maybe ladies menstruating. There is an antibiotic, rifampicin. Oh, okay, so rifampicin is bright orange, so it's not that. There is also myoglobinuria, which is where you get myoglobin in your urine, and myoglobin is a breakdown of muscle, so you could have something called rhabdomyolysis, which is where your muscles break down really quickly. For example, excessive exercise or like trauma. So if you've had extensive trauma, then the muscle in that area will obviously start to break down, causing myoglobin to be released into your urine.
Kidney stone.
So kidney stones would cause hematuria, and that again would be quite a deep red.
Kidney stones would cause what?
Blood in urine.
What color is your pee?
Yellow.
What color is your blood?
Red.
What colors did I use?
Red, yellow, and brown.
And brown. What causes brown?
Waste.
Which means the kidneys are shutting down. Why?
So that makes this sign that he's seeing, being myoglobinuria, so much more likely, because if the kidneys are shutting down, well, myoglobinuria is a cause of acute kidney failure. And I might be sounding like, hang on Aymara, how do you know all this? This was what my disc was about, causes of acute kidney injury, and rhabdomyolysis or myoglobinuria was one of them, so...
Trauma.
And that his history would indicate.
Could be damage done by the self-injection of the Demerol.
Treatment?
Heat and rest.
Other possible causes.
Infection.
Come on, antibiotics. What else? Come on, come on!
I don't know.
You're useless. But at least you know it. Blood tests show elevated creatine kinase. What does that tell you?
Creatine kinase. I'm not sure how, but I think that is related to rhabdomyolysis. Is that? I think that might be the enzyme that breaks down muscle. Oh, okay, no, so creatine kinase is found within the muscles, so when they break down, that would cause an elevated creatine kinase level in the blood.
What are they missing?
You know, it's kind of hard to think when you're in our face like
Yeah? You think it's gonna be easier when you got a real patient really dying? What are you missing?
Muscle death.
Thank you. I'm a bit of a pro right now. Feeling pretty proud as a, on the whole, less than knowledgeable fourth year medical student.
Dying muscle leaks myoglobin. It's toxic to the kidney.
Okay, you have no idea how proud I am. Okay, let's move on to the next scene.
First intern interview is already here?
Yes, 45 minutes early.
We know they all have the grades. We just need to see if they're...
Functional human beings.
You deserve this, and even though you overdosed your Aunt Joan on her blood pressure medication, you're awesome because you can recite every artery in the body alphabetically.
Yes, there probably are some medical students that can recite every artery in the body.
Abdominal aorta, alveolar anterior, alveolar inferior, alveolar superior.
We're finished here.
Next.
I know that I'm younger than most of your applicants, so to answer some questions you may have, I went to high school at 12, I went to college at 14, I went to medical school at 16, and I lost my virginity at 18. You may not have asked that last one.
Weaknesses, I hate all my peers. All of them. Med school is filled with legacy kids who expect everything easy. I had to work my ass off for everything that I have. I saw what I wanted, I took that aim, and I earned it. But if that attitude is a problem, you definitely shouldn't hire me.
I wouldn't say that's a weakness.
You'll get a major signal boost from me. When I started med school, I had 47 followers on Instagram. That number's over 10,000 now. People are
Come on, guys, let's get me to over 10,000 on Instagram.
really invested in my journey. And when I'm here, that'll become our journey. Oh, which reminds me, can we get a snap? One.
I just want to help people, and I think that doctors can save lives and change the world. I don't begin to say
I'm sorry, can you just speak up a little bit?
I just want to help people, and I think that doctors can change the world, help save lives, and eradicate disease.
I never use lengthy medical terms, always use first names. I try to connect with them over an anecdote or a shared experience.
Fair enough, sounds like actually some pretty good communication skills and bedside manner.
I think patient connection is just as important as surgical dexterity.
Well, nobody ever bled out from rudeness.
Okay, maybe as a surgeon, when considering your patient's mostly asleep, communication isn't too important, but I think it's a lot more important than people give it credit for. I think a lot of surgeons could use with a bit of her skills. Oh my god, it just seems like I'm bashing surgery in this video. I really don't mean to be. Surgery is very important. I just sometimes think it's my mission to bring them down a peg, considering that's what they're always doing, psychiatrists.
Right. Not as important.
After I finished undergrad, I applied for the primary care rotation in Nepal.
How did she sneak that in?
Why did you bring a dog to your interview?
Emotional support. And legally, you're not allowed to ask me that.
I love how much the other doctor really likes the dog. Like, he's like petting him a bit. That's so adorable. Look at him smiling. Okay, now that is the end of Medical Student Reacts to medical student scenes in popular medical TV shows. I hope you guys enjoyed it and learned a thing or two. That was very enjoyable. If you guys want to make this into a series and you have any other things that you'd like me to react to, please comment them down below. I'd be happy to do that. But anyway, yeah, like, subscribe, turn on post notifications, and I'll see you in the next one. Bye!